Fulfilling Lives Southeast has used 8 methods to instigate, nurture and achieve systems change. This has led to positive changes in all the thematic areas we have worked in. We will now share details of these methods paired with a worked systems change example to help bring this to life.
So our first systems change method is engaging in consultations, which means in practice a structured process designed to gain stakeholders' input on a specific social problem and proposed course of action. Completing online questionnaires and surveys and producing reports in response to calls for evidence. So we enacted this method by allocating appropriate time and resources, focusing on specific relevant calls to action, and by ensuring we have the data and evidence to back up our submissions. A spotlight example for this method is our input into the Pan-Sussex Strategy Domestic Abuse Accommodation and Support 2021-2024. To put this into context, the Domestic Abuse Bill is enacted in April 2021. Part 4 of the Act places a new duty on local authorities, requiring them to assess the need and commission support to victims of domestic abuse and their children in safe accommodation services in their areas. Statutory guidance published by the Department for Levelling Up, Housing and Communities in September 2021 states that local authorities must conduct a local needs assessment and prepare and publish a local strategy which should include how they will address the barriers faced by victims with multiple and complex needs. The draft Pan-Sussex Domestic Abuse Safe Accommodation and Support Strategy underwent an 8-week public consultation period, and the final version was published in January 2022. So our involvement in the process of change, the issue. So we knew from our frontline work and the voices of lived experience by our service user engagement team that women with multiple and complex needs who experience or who are at risk of domestic abuse have distinct needs, including safe women-specific accommodation options, so that they are not excluded at the time when they most need support. So we worked alongside the Office of the Sussex Police and Crime Commissioner to co-produce our evidence and recommendations for inclusion in the strategy, taking into account the specific needs of women experiencing multiple disadvantage. As a result, we were delighted to read Responsive to Multiple Disadvantages was named as one of the 6 key strategic priorities in the Pan-Sussex strategy. So the aspiration for this work is that accommodation and support options appropriate for the needs of domestic abuse victim survivors with complex needs will be enhanced, including short-term respite facilities, specialist housing, and in-reach and floating support. So the methods we used were allocate time and resources. So this meant tracking local and national policy development to identify engagement opportunities in consultations. We conducted desktop-based research around the development and implementation of the Domestic Abuse Act, which was a useful tool to keep up to date with current events and helped us to identify the opportunity to engage with the Pan-Sussex Needs Assessment for Safe Accommodation. Decide on explicit calls to action. The fact that there is a consultation means a need for change has already been identified, so don't be afraid to be bold in your feedback and views. Fulfilling Lives Southeast presented a report with a focus on the needs of women with multiple and complex needs to the Sussex Police and Crime Commissioner's Office. Within this, we made explicit recommendations for the commissioning of new and additional services to improve access to support in safe accommodation for women with multiple and complex needs. Ensure you have data. So this is best achieved by giving prominence to the voice of those with lived experience. We supported a woman, for example, with lived experience to write a case example, sharing her story of navigating the complex housing system in her words, and included this within our report. We also embedded client data throughout to back up our claims. Follow-up. By this we mean follow up on your contributions and hold responsible agencies to account. Members of the Fulfilling Lives Southeast team gathered and expressed impressions of the draft strategy from across the team and collated the feedback into a further report, which was shared with the consultation coordinators at the Police and Crime Commissioner's Office. Action groups. This means a group who shares a common purpose can help make your engagement in consultations more impactful. People with lived experience in our domestic abuse and complex needs working group help to shape our calls for action and key messages within this consultation.
So the next systems change method that I'm going to be taking you through is speaking with traditional seats of power. So this method involves mapping governance structures to understand where traditional decision making takes place. This mapping process enables you to identify points in the system where changes can be requested, debated and engaged with. Traditionally, these system points can include national parliamentary democratic structures through to local commissioning practices and relationships. And once mapped, calling for change will often require formal requests for time to meet with decision makers or to table a formal question or call for change in traditional decision-making spaces. It's likely that you'll need to share information ahead of meetings in the form of a succinct document clearly stating what you'd like to discuss, why you feel the issue is important, and data to support your case for change. An example of our project work where we feel like we've been able to effectively use this method is through the development and lobbying for the adoption of a Charter of Minimum Standards for temporary accommodation. The starting point for this work came from our casework, which showed that conditions and practices in some TA were concerning, with issues around safety, a lack of staff training, and worrying physical standards. We were then inspired by the work of Citizens Advice Eastbourne, who drafted the first Charter of Standards for temporary accommodation, following research in 2018, which highlighted worrying standards of accommodation locally. A Charter of Standards, which is agreed by both councils and TA providers, would create a contractual framework for ensuring and safeguarding appropriate standards in this type of accommodation. And this is the type of change that we wanted to achieve through the project. So when we were working through this method, these are sort of steps we followed. So we started by equipping ourselves. By that we mean building an understanding of the governance structures for the support system that you want to see changed. So from our conversations with local housing departments and the wider network of housing and homelessness services that we work with, we were allowed to develop an understanding of the governance structures and the individuals that we would need to target in order to effect change. From these conversations, we learned that adopting the Charter would require the authority of elected members. Next, we established a group. Building a group of people prepared to work together for the long term to champion change and to share the workload is really important. Fulfilling Lives started by discussing this approach with Just Life, who chair the Brighton and Hove TAG, which is the Temporary Accommodation Action Group, and we agreed that a charter would be helpful. We then presented the draft content to the TAG, who refined and supported the charter. Have a clear case for change. From a strong case for change come compelling calls to action to help busy leaders readily see the value of the change that you're calling for. So ours were informed by case studies and recurring reports to the TAG, and that formed the basis of our case for change. And then the charter itself provided a clear document setting out the calls for change that we wanted to see for people living in temporary accommodation. Next, build a robust evidence base, and this should come in the form of qualitative and quantitative data to reassure leaders that the changes you're seeking have been thoroughly understood and considered. Fulfilling Lives and Just Life presented a deputation, which is a speech, to a housing committee meeting in November 2020. And this included a lived experience account from a Fulfilling Lives client about their experiences in TA. Councillors supported the charter, and we made subsequent deputations in 2020 and 2021 to ensure that the charter remained on their agenda. Finally, seek support. Ideally, this will be in the form of other influential leaders who can support your call for change behind the scenes. So throughout 2021, we continued discussions with Housing Committee co-chairs and Housing Department leaders in order to integrate the Charter standards into the new emergency and temporary accommodation provider contracts. And in November 2021, Brighton and Hove Housing Committee confirmed that the next emergency accommodation contract will include the higher standards which are aligned to the Emergency Accommodation Charter, which is a piece of work we're really proud of.
My name's Alan. I am one of the systems change officers at Fulfilling Lives. The next method we're going to go through is galvanizing opinion and debate. This method helps to break down barriers in the system when long-standing challenges have been widely acknowledged and there's a lack of optimism that change is possible. This approach involves sparking a new debate and reframing issues so that a wide range of stakeholders feel comfortable discussing and debating the challenge and topic. Creating and holding a space where different points of view from a diverse range of people can be shared enables us as systems changers to draw together common threads and themes. Gathering ideas and opinions can generate new ways of looking at an issue, draw out new solutions, produce new learning in any under-researched areas, and give credence or challenge to a systems change project idea. Translating debates into action is a challenge of this method. Without action, there's a risk that the exercise becomes a talking shop. Further challenges include feedback, which can disrupt the course of planned projects, limiting the time and space needed to thoroughly consider how this impacts your trajectory. However, benefits include gaining valuable learning and reflections on long-standing systemic issues that have often felt immovable. We used this method during 2020, facilitating conversations with 17 professionals, both specialist and non-specialist, from across mental health and substance misuse services, ranging from clinical psychologists and commissioners to leaders of organizations, service managers, and frontline workers, as well as 6 people who had experienced substance misuse support services and had contact with mental health services during their recovery journeys. The topic under discussion was, what does good psychological support look like for people with multiple complex needs who are entering formal substance misuse treatment? In 2021, Fulfilling Life South East hosted a learning event to share and debate this learning further with local and national partners from across the sector. Our work was picked up and included in the Turning Point's new sector toolkit for professionals working with people with coexisting substance misuse and mental health. The Perspectives project also showed us that there's a large research gap in this area of psychological support, and our work could add value to inform future service provision. This project encouraged Fulfilling Life South East to invest in a pre-treatment trauma stabilisation pilot role in Brighton and Hove. This role worked with clients using a new approach that tests a form of psychological support for women experiencing MCN. Early outcomes from the pilot are very positive. The steps we used for this method are as followed. Firstly, establish a clear topic. From this, we are looking to debate and engage with a wide range of stakeholders who can see the topic from different perspectives. Write a brief. This allowed us to help stakeholders understand the parameters of the conversation we wanted to have and feel more comfortable sharing their views. Develop a learning framework. To maximize our collaborations, we have learned from an experienced researcher, trained in social research methods, the best ways to structure the overarching approach, focus groups, interviews, content analysis, and presentations. Publish reports. Publishing reports in collaboration with your contributors is impactful. This assigns value to the work and enables you to share it more widely to galvanize further debate. And finally, use the opinions. We used our most influential and expert stakeholders to pose questions about the status quo and encourage engagement from a wide range of voices to share next steps. This is what you can use as your action plan to take forward.
Everyone, I'm Emily, Systems Change Project Assistant, and I'm going to talk through another important systems change method that we have used, which is finding, naming and supporting bright spots. So in practice, this means using a structured process to identify those services and projects that are delivering the best outcomes for a cohort of people, despite operating in the same context as everyone else. So learning as much as we can about these bright spots is then vital, as this helps to find out what they're doing differently to everyone else. And we enacted this method by using the positive deviancy process to identify bright spots. So this is a method that is developed in the international development sector, and it enables you to effectively seek out the people, teams, organisations or communities that are producing better outcomes. So following on from this, we then used an appreciative inquiry approach to develop questions to ask these identified bright spots. And we found this approach really useful as it helped us extract the best learning from them. And then from this, we then shared findings of this work to encourage others to adopt these new ways of working. So an example from our project work where we have effectively used this method is through our collaboration with the Homeless Health Inclusion team at Sussex Community NHS Foundation Trust. So this is a team that lead the Step-Away service in Brighton and Hove. And the Step-Away service provides community rehabilitation support for patients who are leaving hospital to help them recover effectively in the community and avoid hospital readmission. And they also work with people who are homeless and have experiences of rough sleeping. So why is this collaboration important? The average life expectancy of people with MCN is 51% less than the general population. So we know that health inequalities disproportionately affect people experiencing multiple and complex needs, and that restricted access to healthcare is a strong and consistent theme in the lives of people that experience MCN. So Fulfilling Lives and the Homeless Health Inclusion team shared these concerns and felt we had a common purpose, that the system could be doing better to support this group of people. So what action did we take and how did we use the Bright Spots methods? And in 2020 through to 2021, the local commissioner had secured funding for a step-away service. So Fulfilling Lives and the NHS team were already having conversations about how we could work together. And this provided a great opportunity to harness this funding to explore new ways of working to better support people experiencing MCN. So we set up a steering group to bring together the stakeholders involved in the step-away service to share learning, share where we were seeing gaps in the system, and share ideas for how things might be improved. And then within this, there was a growing concern expressed about younger patients and a feeling that their frailty levels were a lot higher than you would expect, and this exacerbated their health inequalities. So this led us to explore frailty more closely, and using a frail score to assess frailty is something that is more commonly associated with older patients to assess things like their mobility, care and support needs, and it's often paired with rapid access clinics with support on offer as a kind of one-stop shop to respond to patients' frailty scores. So we asked the question, could frailty scores be more useful for patients with MCN? And we decided to trial it and see what impact this had on a patient's journey with the step-away service. And Fulfilling Life supported the team to monitor this impact and analyse the aggregated data. So what was the impact? Well, for patients, for some this helped them better understand their frailty and their health in new ways. And for some it also helped bring to light concerning policy pharmacy issues that were then rectified by holistic reviews of patients' prescribed medication. And for others, having a frailty score helped unlock access for new social care and housing pathways as well. In addition to this, the frailty score introduces a new form of assessment that looks very holistically at a patient's health and wider health determinants. And we found that the frailty score can communicate patients' needs across systems. So it provided a common language that was not rooted in strict clinical language, making it more accessible to patients. And highlighting frailty also helped open up new referral pathways to further support. So for example, frailty scores clearly identify mobility and self-care needs, and this did help a few patients gain access to different housing options and social care support. So we're really proud of this work, and because of this, we communicated our learning at the Pathways from Homelessness conference in March of this year. And we've received interest from outreach staff and a housing organisation who are keen to explore trialling this frailty score in their work. And we truly believe that it is a vehicle to help address health inequalities.
The next method we're going to look at is supporting organisational development. Organisational development and implementing change can be a lengthy process, so it's good to have some core goals to strive for. Firstly, continuous improvement. Although culture change can be difficult, it opens up valuable opportunities for staff to feed into the change process and have ownership over new ideas. Workforce development. Through providing high quality learning and development, staff will be equipped with the skills, knowledge, and confidence to work within the new approaches. Improving service provision. By researching thoroughly and obtaining staff and client feedback, the quality of the service offer can be greatly increased. Fulfilling Lives South East and the local Department for Work and Pensions team in Brighton Job Centre Plus forged a partnership with a joint goal to develop services so that people with multiple complex needs are best able to access, engage with, and benefit from their local Job Centre Plus. In collaborating with DWP managers to understand the challenges through the eyes of customers with multiple complex needs, Fulfilling Lives provided a foundation for DWP managers to open up internal conversations on the most difficult aim of systems change, but likely the most influential and compelling, culture change. Alongside Fulfilling Lives, the DWP managers effectively communicated to the wider workforce how the organisation should be thinking about and supporting customers with multiple complex needs. This created momentum and professional curiosity That was evident through the positive engagement from the over 350 DWP workers that Fulfilling Lives facilitated online workshops and webinars for. This learning and momentum created a platform to communicate in a way to DWP senior leaders that painted a clear picture on what was possible in supporting this group of customers. The steps we used for this method are as follows. Firstly, identify the area to improve. Draw on the voices of people with lived experience of the organisation's services, paired with staff and partner agency feedback. Conduct research to build your evidence base for change. Take time to learn more deeply about the area for improvement, what the obstacles to change might be, and if previous attempts have been tried, why these initiatives failed or did not last. Build a project plan. Include actions for clear communication with staff and stakeholders. Motivate and set out the vision. Support leaders of the change process to communicate the vision effectively to staff and stakeholders, setting out why this is important and the intended impact. And finally, implementation. Support and train staff with new skills, knowledge, and confidence to effectively transition into new ways of working.
So this is going to be the last method, and it's going to be how we change systems by using learning and educating. This method is about increasing awareness and improving understanding of an issue in order to promote change in behaviours, practice, and ways of working. And it's an important part of changing systems. When it's done well, this approach can help stakeholders gain access to information that enables them to think critically about an issue at hand and reflect on behaviours and practice and enact changes. In utilising this method, it's important to ensure that people have the skills and the space to enable new attitudes and behaviours. Training sessions, toolkits, guides and videos can provide practical advice, guidance and tips on applying the principles of the learning that you've shared to their work and activities. This approach has a focus on educating, providing safe spaces for challenge and inspiring new thinking around a particular issue or group of people in society. So where we've used learning and educating to realise change in our project work is through our training partnership with the University of Brighton. We knew from our casework that a key issue in our work in repeat removals was that women often feel disempowered throughout the process of working with social services, not understanding their rights or having a firm grasp of what is happening at each stage. In turn, we identified that increasing awareness and improving understanding of the impact of trauma and how to support and work with women with multiple and complex needs who are experiencing repeated removals of their children into care was a key action in addressing the issue. As such, the change we hoped would come from this work was that the future workforce would be empowered to better support people with multiple and complex needs and placed in a position where they can further influence social work practice in this area. We firstly identified our target audience. This means the group, organisation or individual whose action or behaviour change will be most important in achieving your goal. We knew that social workers play a key role in providing support to women with multiple and complex needs experiencing the removal of children into care, particularly as a statutory social care service. Next, we established our methods. Which awareness-raising methods will be most accessible to your target audience, whether that's a training programme or an academic research study. So after identifying that we wanted to target students before they started social work as their profession, training in the form of guest lectures at the university was our chosen method for awareness raising. Next, networking and connecting. This means working with other organisations with experience in your field or good links with your target audience. Find allies who can help spread a unified message. We were lucky enough to have connections to the University of Brighton via Lucy Bastera, a senior lecturer in social work, and this partnership gave us a really valuable platform to reach students. Embed lived experience. Ensure people with lived experience inform and deliver efforts to raise awareness and understanding. So for this work, the content of the guest lectures was co-produced by people with lived experience of multiple and complex needs. The lectures themselves were then also delivered by frontline practitioners and experts by experience. And then to celebrate, the work was captured in a blog, which was co-produced by the group. Embedding lived experience at every level possible builds empathy, connection, and breaks down stigma. Create compelling messages which define achievable and tangible calls to action. Focus on what can be gained from a behaviour change. So as well as the content from the lectures being drawn from lived experience, frontline practitioners gave tangible advice and guidance to the students, with the overarching message that the more equal the relationship between worker and client from the beginning, the better the outcomes will be. And finally, ensure that your evidence base is robust. This will allow you to reassure your audience that you're well informed. It may involve research to capture lived experience, conducting academic literature reviews, or local policy reviews. So both the lecture and the evaluation of the lecture were well evidenced. So feedback from the lectures was captured, and then off the back of the overwhelmingly positive response, Fulfilling Lives resources will continue to be used to teach at the university, in turn making this upskilling of a future workforce sustainable into the future.
By sharing these methods and worked examples, we hope this helps to demystify the systems change thinking and demonstrate tangible ways that systems can adapt and improve.